5 to 18% of women are shown to have PCOS in their childbearing years. In fact, 1 out of 10 women have been shown to have PCOS in their early 20s and in their 30s. In fact, a lot of women don't even get themselves diagnosed even after having symptoms or not having symptoms and still having PCOS as the main culprit of their infertility or many other issues. In fact, this has become so common, and we don't know what exactly are the causes of PCOS in today's time. Why is it getting so common these days? So in today's video, that's what I'm going to talk about. So what are we going to cover in this video is, first is what is the difference between the PCOS and PCOD. There is so much confusion about this. What are the types of PCOS? What actually causes PCOS? And what are the unknown symptoms of PCOS. There is a small takeaway in this video, so just make sure that you stay till the end so that you can grab your bonus. Now let us see what is the difference between PCOS and PCOD, because there's so much confusion. Let's clear this up. So PCOD was the initial name that actually was given by the doctors, and this was actually given when they found that there were multiple immature eggs in the ovaries which formed small cysts, giving us issues like hormonal imbalances, excessive production of male hormones. This is what was known as PCOD when it was discovered as a disease. Now, eventually, when the doctors realized that PCOD is a condition which is not just associated with immature eggs, but it is a syndrome of diseases. So, it's a complex endocrine disease with multiple symptoms, metabolic symptoms like obesity, insulin resistance, high androgens. All these things in a complex gives a name as syndrome of diseases. That's why it is known as polycystic ovarian syndrome and not called as ovarian disease anymore. So it was just the old name, and the PCOS is the new name. Both remains the same. The only condition in PCOS is that if you have any missed period or irregular period, or maybe you have high androgens, or you see ultrasound PCOS, that's when it was considered as PCOS condition. But a lot of time, in fact, these things also might not really show. There are a lot of unknown symptoms which might be showing, and that can also be leading to PCOS condition, which we will cover later. Now let us see what are the possible causes of PCOS in women. Number one, and the most common cause of PCOS, is actually insulin resistance. Now, what came first, whether it's insulin resistance or PCOS, it's still not known. But PCOS women generally have insulin resistance, and that's why whenever somebody goes to a gynecologist, the gynecologist will always put these people on metformin, which is a medicine for insulin resistance. And it is seen that when they start having this medicine, it starts improving their PCOS conditions a lot. Whether to take it or not is a second thing, but definitely if somebody has PCOS, they need to work on their insulin resistance for sure, even if it is not showing in their blood reports, because women, when they treat their insulin resistance, they start improving their PCOS very, very drastically. Okay, so second reason is hormonal imbalance, and in hormonal imbalance, what is generally seen is the high testosterone level. So again, it is associated with insulin resistance. So somebody who has insulin resistance tend to make the ovaries more bulky and produces more testosterone, and whenever the testosterone is high, it will make the ovaries more bulky, and this leads to cyst. All these things are interrelated to each other, and that's why women are also seeing irregular periods and ovulation problems, which leads to high luteinizing hormone in such women. So generally it is seen that the ratio of FSH and LH, the LH is almost double the quantity of the FSH in PCOS women. They also might be seeing low SHBG hormone, which is generally associated with the testosterone, it's a protein that is attached to the testosterone to reduce its effect, but that is generally seen low. The prolactin can also be high, which can lead to irregular periods. Third cause can be gut dysbiosis. There are a lot of researches actually which are done on the relationship between the gut dysbiosis and PCOS, and it is generally seen that women who have poor gut health or maybe having leaky gut issues, they tend to have high LPS levels, that is lipopolysaccharide, which enters into the bloodstream, causes high inflammation and insulin resistance, which can lead to PCOS as well. So this is one of the common reasons which is generally seen. And next is poor diet and lifestyle. Of course, whenever somebody is too sedentary, not eating right way, having lots of junk food, having too high carb diet and gluten rich diet and lots of sugar, they are not moving enough, is seen to have a lot of PCOS and insulin resistance conditions. Next is stress. Now, stress is generally seen in people when they have so much of work or their lifestyle issues, but it is also related to maybe environmental issues, the endocrine disruptors, the chemicals, the use of cosmetics. All these things will also add to the stress. So whenever somebody has a poor lifestyle, the environmental issues, mental stress, physical stress, if it is too much stress that is going on, it leads to high cortisol levels, and this cortisol, when it remains high for a long time, it can lead to insulin resistance and eventually lead to PCOS. Next is genetics. Now, genetics has 20% impact on your hormones if somebody has a family history of PCOS, but if the trigger generally happens in their younger age, maybe the exposure of the endocrine disruptors, maybe the antibiotics that has been taken for a very long time, or maybe somebody had a surgery or some traumatic event or emotional stress that led to any sort of a trigger of that genetic problem that was switched off while they were born, that gets switched on when they have any sort of a trigger. And when this trigger is actually meeting the mediator, that is like maybe you're carrying on the same lifestyle like your parents had, you're not taking care of your health, all these things as a mediator increases the chances of switching on the bad genes which you are carrying from your parents or your grandparents. So genetics plays a role, but only 20%. But if you don't take care of your genetic issues and leading the same lifestyle as your parents and the other forefathers did, it is going to be very much dominant in your body. Next is exposure to toxins. Like I said, exposure to toxins like chemicals and pesticides, hormones, or maybe a lot of EMF rays, cleaning agents, cosmetics, use of plastic, all these things can lead to a lot of xenoestrogens to enter into your bloodstream, and it starts dominating and it affects your hormonal imbalance, and this can lead to PCOS very commonly. So did you understand that it is so important to understand that what could be the main cause of PCOS? Even if you don't know about your PCOS cause, it's completely fine. But taking care of all the aspects that I covered here is very important in the recovery of PCOS. Now let us see what are the types of PCOS that will help you understand that which category could be giving you PCOS issue. Type 1 of PCOS is insulin resistant PCOS, and this is the most common type. And in this, obviously, because as like the name is suggested, it's the high insulin level that actually causes the androgens to increase, and that's when it is known as insulin resistance PCOS. Now, the second type of PCOS is post-pill PCOS. So if you had any hormonal pill, so after that, when you withdraw that pill, that gives you PCOS. So withdrawal after stopping the hormonal birth control pills, any form of birth control, leads to PCOS as well. Type 3 is inflammatory PCOS, and again this is a very common one, but it is seen generally when there is chronic inflammation which leads to PCOS. Like I said about the LPS also, when that increases, it increases the inflammation, that can lead to PCOS as well. And triggers can be here found from food sensitivities, toxins and gut issues, high intake of sugars and carbs, and also stress levels in fact. Type 4 is adrenal PCOS, and this is mainly associated with stress as well, and having DHEAS hormones elevated compared to all the other androgens is a very significant symptom that it is adrenal PCOS. So in this case, the cortisol also remains high, and when cortisol is high and the DHEA, which is an androgen, which also remains high, it's a very significant symptom that your adrenals are fatigued, and in this case rest recovery becomes a very important thing. So understanding which type you belong to becomes very significant here, so that we can do the treatment as per your body's need. Understanding what type of PCOS you have makes the protocol much easier. So there is no straight line to any diagnosis, or there is no straight line to any treatment. Understanding the root cause of your medical issue is very important. So say for example, if you have adrenal type of PCOS, where the rest and recovery is very important, sleep pattern is very important, stress management is very important, and on top of that, if you do very high intensity workout, excessive workout, or extreme dieting, the PCOS will never be able to solve, because your body takes it as a defense mechanism. It will not allow your body to lose weight very easily. It will not allow your hormones to balance well, because the entire focus of the body is to stay protected from the stress that you are giving to your body. So as a defense mechanism, it will not allow you to improve your condition. So understanding the root cause of PCOS is extremely important here. Once you know that, it becomes easy to do the treatment properly. Now let us see some unknown and hidden symptoms of PCOS, which are commonly seen, but women are ignoring these things, thinking that it is normal, and sometimes the report also shows as normal, but there are many symptoms that one can have. So if you have too many of these symptoms, then it is better to consult a health professional, so that you improve your hormones and correct it and live a healthy life. So generally, women will have weight gain or difficulty in losing weight, but it's not necessary. Even the thin girls can have PCOS, but this is one of the common symptoms that is generally seen. Oily skin, jawline acne is also very common. If you have too much cystic acne, and if you have jawline acne, this is a very common symptom of also estrogen dominance. If you have irregular periods, or you have no period at all, or you have an ovulation, sometimes you're getting periods, sometimes it is irregular, all these things can also be a symptom of that. If there are dark patches on your skin, especially around your neck, around your elbows, on your back, on your cheeks, all these can be a symptom of that. If you have infertility issues, if you have really thick hair on your face, even on your body, even below your belly button is also a commonly seen symptom. Thinning of hair or too much of hair fall, which is generally seen in male type baldness pattern, or maybe scanty hair is also commonly seen, or you have heavy menstrual flow, you have high estrogen levels, or you're having PMS issues like mood swings and extreme sugar cravings, you have fibroid, or you have endometriosis, or you have too much of cramp during the periods, all these things could lead to PCOS. So if you have too many of these symptoms, or maybe more than 3 symptoms commonly seen on the regular basis, then there is a possibility of you having a PCOS, or maybe insulin resistance, which can be a starting point for PCOS. So get yourself checked with a proper health professional for this, so that you understand what exactly it is. Now I just want to give you one important information here, is that in functional medicine practice, we generally take different way of checking the blood reports, different way of understanding the hormones, unlike the conventional way of checking the reports. So it is very different in functional medicine. So a lot of times it remains undetected in the conventional medicine that what exactly is going wrong. So women will have irregular periods, they don't get sometimes regular periods, sometimes they have heavy periods, sometimes they have scanty period. It remains undetected and their reports come absolutely normal. It is very frustrating for people to actually know what is the problem actually happening, but when they go and see the doctor, everything is coming to be normal. We check everything in detail and in a different way, and we are able to understand the deep root cause of the problem in much more details. So all these things is what we do in our practice, and for today I have this free bonus for you, which you can download from the link that I have given below, and that exactly is the way to track your periods. And in that I have given a lot of details about how your period should be like normally. If it is falling in the normal parameter or not, how can you understand when are you ovulating. Everything in detail is what is written in the PDF that I have given in the link. So please make sure that you download your copy and make use of that. So for today, I end this video, and I will be making much more detailed videos on PCOS and a series on that, and lots of hormonal balance videos. So stay tuned, and I wish that you stay healthy always.